So, what's one thing you discovered in the past few weeks that might benefit others that are maybe a couple weeks behind where you guys are at?
Well, so first of all, I'm going to talk about crisis and emergency. So I know people ask me, well, what did you do? We've been, fortunately, unfortunately, I've been through many crises, including September 11, blackouts, Sandy, storm, and of course this. And part of that is our institution having a good emergency planning since even Sandy and before that in place. And that's a broader institutional plan about, in case of an emergency, what to do, and we plug into that. And then when IT, we create a structure for many years in place to how do you deal with crisis. Now, we all know, and based on my experience, and there's crises all different. So you never get the same crisis again when people thought. So the question is, how do you set up a structure to deal with the crisis with assets and be able to, react quickly, improvise as different issue arises. So this crisis is totally different than what Sandy was. Sandy was an event and happened, and then you have to deal with aftermath. This is continuing. So in such, you have to prepare your staff to dealing with this on an everyday basis. And so it's a different type of crisis. So you got to be very nimble and agile as the need changes to be able to deliver the technology services, whether that's expanding ICU, telehealth, and various other things. And the other thing is about really having your technology architecture in the way of integrated environment and capability really matters. This is where it shows us either it's crack or strength of how you architected your technology infrastructure. And that's puts it to real test here. Both your staff and your structure and your technology capabilities.